Well, one last message. The Chinese saying to treat the disease the best is to prevent the disease from happening. And I would like to give you some ABCs of how to prevent having a stroke. That means by reducing the risk of stroke. And let's start with the A's. A's meaning alcohol. While a small consumption may be beneficial, a moderate to large amount of consumption would increase your stroke risk. A also stands for atrial fibrillation. That means irregular heartbeat. If you feel that you have palpitation, your heart beating fast, irregular, or have a big thump, that's when you have to bring this to your physician's attention. B stands for blood pressure, and that's the number one risk of strokes. If you're able to lower your blood pressure to a level of 120/80, I know you may have been told a higher level is okay, but 120/80 is the latest recommendation. You'll reduce your stroke risk by 40%. C stands for cholesterol. We all know that cholesterol is bad, and high cholesterol will increase stroke. Of the cholesterol subgroups, the LDL is the most important. Remember the limit of 100, but if you belong to a high-risk group, the limit is 70. D stands for two things. Number one is diabetes mellitus. If you have diabetes, it's very important that you should have it checked and treated by your physician and have your blood sugar controlled tightly. The second D is our favorite, diet. You all know that you should eat healthy, appropriate amount, fresh fruits, vegetable, and minimum amount of meat. And avoid the fried food, the fatty food. E is probably the most important thing you can do for yourself, and that stands for exercise. The recommendations says that you should exercise a minimum of 45 minutes a day and a minimum of 5 days a week. And what I like to tell my patient is, if you are doing your exercise to begin with, why don't you do it more than 45 minutes? Why don't you go to an hour or more if you enjoy it? And if you are doing it, why don't you do it every day? F stands for the thing we don't want to think, and that's fat. And we measure fatness not by the BMI, but rather by the abdominal girth. And for a woman, it's 32 inches and above, you are fat. And for a man, 40 inches abdominal girth. So try to do as much as you can, follow these ABCs, and I can assure you the risk of your stroke will be less. Thank you.